Now, on to what you need to do for your homework here. The first thing is watch the orientation. The orientation explains chiropractic, how it works, how you get well, how you stay well, how you maintain that. Okay, so that's important. It's about 20 minutes long. Watch that. If you haven't got that video, please contact the office. The second thing is, when you get out of the office here, generally, if you're capable, I'll ask you to walk. Remember, one of the criteria of a subluxation is restricted motion into that joint. So when we set that vertebrae back into position, joint motion is going to start reoccurring again. So we want to make sure you're getting the most out of it. That's why we'll say generally, if you're healthy enough, take a walk before you get back into your car. Well, this is something you should be doing. It's moving. Generally, for most people, the best motion will be walking. Probably about 85% of people or so, especially those with a fifth lumbar issue, will feel better when they walk. So when you leave the office, you want to take a walk, and you want to do walking frequently, especially right after you wake up in the morning. This is the most important time. Your body is trying to heal at night that area of the subluxation, so it's bringing inflammation to those joints. So when you start moving the joint, that's how you flush the inflammation out. So motion is going to be very, very important to you. And the other thing, remember, if you don't get any motion in it, that disc just starts to degenerate. Okay, that's one of the biomechanical consequences of not getting subluxation corrected. So this first thing is move. So walk. Walk when you get out of the office. Walk first thing in the morning when you get up, and try to walk throughout the day. If you can't walk, we'll recommend for that, most people, this is somebody that might have a base posterior sacrum or a spondylolisthesis, or somebody has more pain while they're standing or walking instead of sitting. So generally we'll recommend to do motion. So generally on this one, you just lay on your back on your bed or whatever, and you bring your knees to your chest, just like this, lying on your back. Don't do it here, but lying on your back one at a time. Do not stretch this. The discs have already been stretched by the misaligned vertebrae, the subluxation. So don't do that. Just get motion into the joint. So the second thing you may choose to do is do icing. And icing is something that will start to decrease the inflammation in the body. The problem with that is, just so you understand, inflammation is there to do the healing job. So if you're trying to decrease inflammation, you're not getting as much healing. So many people will choose to do this just because of the discomfort that they're going through, and I can understand it. And if I have to make a decision on what I'm going to do, I would much rather use ice locally instead of doing it, doing an anti-inflammatory, something to try to do systemically. First of all, it doesn't work anyway because it's not going to get enough to the areas of the discomfort, but icing is something you may choose to do. If it's your low back, you have two bumps here on either side. You'll feel these two bony bumps there, and you're just going to put the ice pack across that. Again, depending on what makes you feel better, what stresses you're putting on it better. Some people may feel better icing sitting. Most people feel better icing standing. So you'll have to decide that for yourself. Again, you just need to figure out what stress is a little bit easier on your body. The other thing, too, to recognize, once you get adjusted, the tremendous neurologic benefits that come from that. When you have a subluxation, again, this is where you have nerve interference, the vertebrae is misaligning, and there's nerve interference there. Your body is in a state of fight or flight. Any type of stress you get, the body goes into a state of fight or flight. And fight or flight will it causes terrible things. You know, you have difficult time sleeping, muscles all tensed up, your heart rate goes higher, your blood pressure goes higher, thinks you're getting bit by a lion, okay? So generally what happens, most people after their first adjustment have an incredible night of sleep like they haven't had in many, many years. So I would hope and expect that for you too. So that's the basics of the homework. There'll be a few more instructional videos out here if you have any other questions.